Now let's talk about in detail the clinical features of the coronavirus disease 19. It is basically all of this data which we have and all of the knowledge about the coronavirus disease is basically gathered from a large trial study which looked at the pattern of the disease worldwide in various countries. The disease has varied manifestations in different parts of the world, with intensity being high in certain parts. For example, currently in the Europe, especially in Italy and Spain and in the United States, and initially in the China, it had a very severe impact. And in certain parts of the world, the disease severity is considered low. This is a disparity which is being looked into by the researchers. And generally, it was found out that to start off, the incubation period of the disease is about 5 to 14 days after the exposure. So if, for example, you have been exposed, you had someone in close proximity who had coronavirus disease, and then you were exposed to that person, then generally it is found out that it takes about 5 to 14 days for that person to develop the clinical symptoms. So during this 5 to 14 day period, which is termed as an asymptomatic period, you are infective and you can spread the disease to others. So that's why it is very important for someone who has either traveled to an endemic area recently, or someone who has been in close contact with a person who has an established coronavirus disease, for example, healthcare workers and other nurses and other medical staff, to quarantine themselves properly and take special precautions, because you can spread the disease even while being asymptomatic. Then, if we talk about the spectrum of the disease severity, majority of the cases of the disease, about 80 to 82%, are generally mild disease. What we mean by mild disease is that there is no or mild pneumonia. Generally, we are going to talk about the classical clinical features in the clinical manifestations, but generally 80 to 82% of the people if they have no symptoms, they are termed asymptomatic, or symptom mild pneumonia symptoms, certain upper respiratory tract symptoms, which are generally also present in certain types of flu syndromes or influenza syndromes. So the majority of the disease is mild. Where it gets interesting, or where it gets troublesome for us, is when the disease is either severe or it is critical. When we talk about the severe disease, generally about 14% of the patients worldwide who presented with the coronavirus have been found to have a severe disease. But the severe disease has classical manifestations, like the patient will present with hypoxia or with dyspnea, which is basically difficulty in breathing. And there is greater than 50% of the lung involvement on imaging within the 24 to 48 hours. So if someone presented to you in the hospital and on the initial presentation, the chest X-ray was perfectly fine, or the chest CT was perfectly fine, and then within the 24 to 48 hour period, the patient started having symptoms of dyspnea and hypoxia, and their condition started deteriorating. And if you repeated a chest X-ray or a CT scan and you found out that about greater than half of the lung is involved on imaging, then we can classify that into the severe spectrum of disease. And then what's left is what is basically the most feared feature is the critical disease. Generally, about 4 to 5% of the patients presenting with coronavirus disease have the critical disease. And these are the patients which generally in patient group in which we have a very high mortality rate. What are the critical diseases, or what are the critical presentations in which the coronavirus disease can either present or can transform? The major mortality basically is from the respiratory failure, or specifically the acute respiratory distress syndrome, or ARDS. ARDS is the feared complication of coronavirus disease, and if someone develops ARDS, then he or she might need some ventilatory support. They might need a ventilator to breathe, because their lungs won't be able to cope up with the oxygenation. The other types of critical disease or the critical presentations which can be deadly are the patients going into the shock, or the multi-organ dysfunction, or the multi-organ failure. So as you can see that majority of the patients have a mild disease, about 8 out of 10 patients have a mild disease, and in the rest of the, for example, 20% of the patients, 15% will have a severe disease, and about 4 to 5% of the features are patients who present with a critical disease, and these are the patients which are generally have a high mortality rate. The overall mortality rate from the coronavirus disease globally has been found to be about 2 to 3%, and out of these 2 to 3%, majority of the patients lie in the critical disease period, critical disease section of the spectrum. If we talk about the impact of age on the coronavirus, initially it was found out, or when the disease started, initially it was suggested that the disease majorly targets the old age population or people over the age of 65 or 70. But now, with an increased severity of the disease and with the disease spreading globally, we have found out that there have been cases of the patients as young as 15 years or 10 years or about 20 years presenting with coronavirus disease. So generally it is now recommended and suggested, with increasing understanding of the disease, that individual of any age, be it a young child or be it an adult, they are all susceptible to coronavirus disease and can present with symptoms in individuals of any age. But the most common group of patients in which the disease generally presents is the 49 to 56-year-old patient population. And these have been found to be the most susceptible, and this is the age group in which the disease has been found to have a clinical impact as compared to the other age groups. So around 50 to 56 years age old patient who are basically on the borderline from adolescence to the old age, they have the most impact of the disease. All right, let's briefly talk about certain what population of the patients we are going to have symptomatic infections. About 20 to 30% of the patients will generally have no symptoms. They will be termed as asymptomatic patients. For example, someone who just who doesn't even know that he has coronavirus disease. There is no symptom at all, and the patients recover on their own. And later onwards, when if the blood test is performed from any purpose, they might find certain antibodies in the blood, and which basically suggested that they had a coronavirus disease and they were not aware of it. But what are the patients group generally who have a symptomatic infection? Symptomatic infection can present in any person, even with good immune system, but majorly the symptomatic infection or the infections which have been found to be generally severe have been in the patients who have certain compromise of the immune system. The most common being someone with a cardiovascular disease who has other comorbidities, for example, someone with a heart disease or a recent MI, or someone with blood pressure, hypertension, uncontrolled diabetes mellitus, someone also having previous respiratory diseases. For example, asthmatic patients have been found to be very prone to this disease, and those are the patients that are also very susceptible to developing the critical disease, for example, the ARDS or shock. Similarly, someone with a COPD or emphysema, or someone with a chronic kidney disease, renal failure. Basically, patients who have a long list of comorbidities. For example, as we saw in the case study, our patient Christopher, he also had a history of hypertriglyceridemia. So someone who has obesity greater than 40 BMI, they have been found to be generally more susceptible. In a study, it was found out that about 60 to 70% of the cases of coronavirus who developed the severe pattern or the critical disease had some one or two comorbidities with them. Either they had diabetes or uncontrolled hypertension, or some heart disease, or any type of lung or kidney disease. So these are the patients which are generally susceptible to developing symptomatic infections. While the asymptomatic infections, any person who basically he doesn't know, he develops asymptomatic infection, the rate can go on from 20 to 30% to even 40% in certain parts. And it basically depends largely on the immune system of the patient, that whether their immune system is strong enough to counter the disease without the development of the feared symptoms, which we are going to discuss in the clinical sections part of the disease.